Not visible, not visible. Let me know. Can you guys see this PowerPoint? Yes. Okay. Awesome. Good. Okay, so we'll go ahead and start then. There we go. So again, welcome. We're doing Question Clinic today. Remember, I'm just covering for Miss Aglo. She will be back next week. She is okay, don't worry. But she'll be back next week. And what else is going on? This week is going to be a short week here at Avant because here in America we celebrate a holiday called Thanksgiving, and so that'll be this Thursday. So it'll be a little bit of a short week, but we'll be back on Monday and we'll do our best to catch up with you guys and get caught up with all that. Okay. So let's do this. Today we're going to do health promotion and maintenance. Okay. So when if you need to ask questions during the presentation or you want to put your answers in, you can do it either on a mobile phone or on a laptop. If you're using your mobile phone, go down to the bottom of your screen here, and you're going to see on that menu on the bottom, it'll say questions, and it has a big old question mark there. If you push that icon, it will take you up to a chat box, and then you can type in questions or answers, okay? If you're on a computer, you want to go all the way on the right-hand side of your screen. There's a menu here. If you click the first icon, that's going to open up your menu for you, and then you would select the questions tab. Okay. So remember, health promotion and maintenance is one of the 4 client need categories. It is one of the smaller client need categories. It's worth about 6 to 12% of your NCLEX exam. Okay. So here's a question. If it's a small topic and it's only worth 6% of your exam, does that mean you don't study for it? Here's a better question. Can you pass NCLEX without answering health promotion and maintenance questions? Okay. Sheena's got it right. Okay, good, Charles. Yeah, you're not able to do that. The way that NCLEX is set up, okay, it's computer adaptive testing. And that means that the next question you get is based on how you answer the current question, okay? And they make sure that the way the exam gives you questions, it covers all 4 client need categories, okay? So what that means is that just because it's a smaller client need category, like health promotion and maintenance, doesn't mean that we can skip it. We've still got to be able to answer that information, okay? So in health promotion and maintenance, we see topics like the aging process, ante, intra, and postpartum and newborn care, developmental stages and transitions, health promotion, disease prevention, health screening, high-risk behaviors, lifestyle choices, self-care, and then techniques of physical assessment. One of the reasons that health promotion maintenance can be a challenging topic for people is that in that ante, intra, postpartum, and newborn care. Okay, you and me, most of us, we're used to taking care of adults, right? I'm used to taking care of adults. I don't think I've never taken care of a child or a newborn ever. So what does that mean? It means that you and I are not really used to taking care of those patients, so it can be a little harder for us to learn that information. But there's no secrets on NCLEX. There's no mysteries. So they'll tell you exactly what topics in that newborn and that intra partum care that you can be tested on. Okay. Remember, guys, types of questions. We can get health promotion and maintenance questions in all kinds of formats, okay? We can get SATA questions, we can get delegation, therapeutic, priority questions. Health promotion and maintenance is not limited to one type of question, okay? It can be asked in all different kinds of formats, okay? So the important thing to do to be successful with that is you've got to study your testing strategies and you got to learn how to use them, okay? If you're new to our program, first of all, welcome. We're so glad you're here. But second thing is, go to your Learn Upon account, okay? Log in, and if you go to the tab NGN Webinar Series, there are recorded webinars. Some of them are in body systems and pharmacology, but there's also some in there that go through your testing strategies, each one, okay? And that is where you're gonna learn those testing strategies. And then when you come to Question Clinic, then you can practice those testing strategies, okay? But we have students come back from NCLOCs all the time who tell us that they wish they had studied their testing strategies more, okay? So the way to answer all these different types of questions correctly is to know your testing strategies, all right? So we're gonna skip that bit. If you are not quite sure where to start with critical thinking, okay, you're not quite sure where to start with your testing strategies, I recommend doing your 6 steps to question success, okay? This is the foundation for critical thinking in this program, okay? And it's there to help you do 2 things, okay? What do you guys, here's a question for you guys. What do you think is the #1 mistake that people make on the NCLEX exam? It's a good question, right? What do you guys think? I'm interested to see your answers. It's kind of an obvious one when you think about it. Okay, we've got some people said not understanding the question, not analyzing the question. Okay, good. Not applying testing strategies. Okay. Oh, good job, Dedan. You got it. Natasha, you got it. The #1 question that we see, mistake that we see, guys, is rushing through the exam. People get stressed when they take exams, and that's normal, but then their brain starts sending them all these signals that they don't have time to take the exam. And what they start doing is they rush through the questions, okay? And what happens when we rush? What happens when we are moving too fast? Well, we don't understand our question. We don't know, we're not aware of that information that we need to answer the question correctly. And then if we don't understand that how can we get the right answer? Okay, so that's the #1 mistake that we see on NCLEX is people rush through the exam. So these 6 steps to question success are here to help you do 2 things. And the first one is help you to slow down just a little bit, okay? And to understand your question better, okay? So that's the first part. The second part is 6 steps helps you to use your testing strategy to eliminate, okay? And elimination is different than guessing, okay? Guessing is random, okay? And guessing does not increase our score on NCLEX exam, okay? But testing strategies are all about elimination, and elimination is different than guessing because it slowly gets rid of wrong answers so that we can get closer and closer and closer to the right answer, okay? So gotta have these 6 steps, guys. So if you haven't done it yet or you're not quite sure where to start, go and do those 6 steps of first, okay? All right, so here we go. First question, guys. Question #1. The nurse would instruct the client taking warfarin for a DVT of the left leg that it is acceptable to continue eating which of the following foods that the client prefers, okay? So remember, you read through your question, make sure you know what the question's asking you, okay? Here's a little key. I like to get rid of the answers. The first thing I like to do is get rid of the answers that I know are wrong. Okay, so maybe start out and see if you can find any of those answers in there. Okay, I'm going to give you guys 2 minutes to do this question, okay? Because that's what you're going to get on NCLEX, okay? So NCLEX, you're going to have 150 questions. You're going to get 5 hours to do it. Most people don't, it doesn't take most people 5 hours, but that averages out to about 2 minutes, okay? So we're going to do 2 minutes, we're going to practice 2 minutes today. And then remember, that is more than enough time to answer this question. So take your time, slow down, take a deep breath, okay? And you'll do great. All right, so let's start that 2 minutes and go. All right, my friends, so that is about 2 minutes right there. So go ahead, put those answer choices in, okay? And then let's take a look together, okay? So question number one, the nurse would instruct the client taking warfarin for a DVT of the left leg. That is that is acceptable to continue eating which of the following foods that the client prefers. Okay, so tell me a little bit about this question, guys. The first part, the nurse is instructing the client on warfarin for DVT. Um, there's not anything that's pretty straightforward, right? That sounds right. We know that warfarin is a blood thinner, and we give that for DVTs. What about the second part of this question? What are they asking us here? It says the nurse would instruct that it is acceptable. Okay. So are we looking for something that the client should eat or the client shouldn't eat? Yeah, good. This is we're looking for something that the client should eat that is compatible with warfarin, okay? All right? So we got to be we there was a moment there where we could have made a mistake, right? Think about it. If it changed that word acceptable to not acceptable, it would change our question, right? It would change our answer, right? So we have to be clear about what we're being asked. We're looking for a food, okay, that is not contraindicated with warfarin, okay? That a patient can eat while they're taking warfarin, okay? So now that we know that, we can keep going, okay? So number one, is it acceptable to eat broccoli while taking warfarin? No, it is not, okay? Why? Remember, one of those foods that has, we have to be careful with green leafy vegetables, right? Why? Vitamin K, good. So vitamin K is contraindicated, or it is uh, it's a warning with warfarin. Okay, so green leafy vegetables tend to have a lot of vitamin K in them. All right, so that would be contraindicated. What about number two? Is it acceptable to eat spinach with warfarin? Yeah, same thing. It's not, right? It's same thing as broccoli. Okay. Green leafy vegetables are very high in vitamin K, and that vitamin K or large amounts of vitamin K are contraindicated with warfarin. Okay, so we can get rid of one and two. All right. Next is three. Is corn acceptable to continue eating with warfarin? What do you think? What is corn made up of? Corn is mostly cellulose, right? Okay. Any what else is it made up of? Does it have vitamin K in it? Yes, it does. It has vitamin K, but it's very low, okay? The vitamin K levels are very, very low in corn. So this could be our answer here. Okay. All right. So let's say three, let's keep it. What about cranberry juice? So number four, is it acceptable to drink cranberry juice while taking warfarin? Okay. No, it's not. Why? Yeah, so it's not acceptable. Good. Why? Good, because there are some kinds of juices that either they potentiate, which means they increase effects, or they can cancel out the effects. Okay, grape juice and cranberry juice are the most common ones. Okay, so cranberry juice, grapefruit juice very commonly are contraindicated with medications. Okay, so between three and four, which one do you guys want to pick? Yeah, you got it. Number three, it has no other contraindications and it's low in vitamin K. So our best answer here is number three. It's acceptable for them to continue eating corn while taking warfarin. All right, good job. All right. If you didn't choose three, that's okay. All right, as long as you understand why three was our correct answer. Okay. All right, so we're going to keep moving on to question number two. A woman scheduled for a simple mastectomy in 1 week is having her preoperative teaching done by the clinic nurse. What educational intervention will be of primary importance to prevent hemorrhage in the post-operative period? All right. Okay. I'm going to give you guys a clue here. I already gave you one clue for the first question. Remember, you always start with eliminating the answers that you just know are not true. Get rid of those first. I'm going to give you a second clue here, okay, for this question. Make sure you know what type of question this is, okay? It will make a difference, all right? So make sure you know what type of question it is. All right, let's start that 2-minute timer and go. All right, guys, we're almost at that 2 minutes. Lots of good answers here. All right. Looks like everyone's got their answer choice in. So good. Let's take a look. Question number 2. A woman scheduled for a simple mastectomy in 1 week is having her preoperative teaching done by the clinic nurse. What educational intervention will be of primary importance to prevent hemorrhage in the postoperative period? Okay, tell me a little bit about this question, guys. First part, a woman scheduled for a mastectomy in 1 week. That's okay. That's straightforward. She's having her postoperative teaching done by the clinic nurse. Okay. There's nothing to that one's pretty straightforward. Okay. So then the second part, what educational interventions will be of primary importance to prevent hemorrhage in the postoperative period? Okay. Did you guys figure out what type of question this is? Remember, I gave you that clue and to figure out what type of question this was before you started. There's a key word in here. Aha, got it. Someone got it. Brenda, good job. Brenda got it. This is a priority question. Okay. Look at that key word in there. The key word here is primary. Okay. So they didn't ask you, they didn't write the question and say, what educational intervention is important to prevent hemorrhage? They asked you what educational intervention will be of primary importance, okay? So what does that mean? That means this is a priority question, okay? So when we get priority questions in NCLEX, what it means is that they're going to give you 4 correct answers, right? You and me, we're used to getting a question and we're used to getting the answers, and then one of those 4 answers is correct, right? And the other 3 are incorrect. Priority questions in NCLEX are going to be different, okay? They're going to give you 4 correct answers, okay? But you need to pick the one that is most important, or in this situation, which one is primary, okay? All right. So that's important to know, okay? That's going to change the way we approach this question. What are we looking, what is our topic here? Hemorrhage postoperatively, okay? So good. All right. All right. So let's take a look here. Number 1, is it of primary importance that she limit her intake of leafy green vegetables? Okay, so no, it is not. Why? A week before? Okay, Maria said it should be the opposite. So you're saying she should increase her green leafy vegetables? Yeah. So here's a question. Do green leafy vegetables, do they cause clotting or do they cause bleeding? They help with clotting, okay? So if we're concerned about hemorrhaging, are we going to stop things that cause clotting? No, we're not, okay? If we have a hemorrhage, we're concerned about things that are going to thin her blood out, right? We're going to make her blood thin and increase her risk for hemorrhaging, okay? So number 1's probably not right. Number 2, is it of primary importance to increase her water intake to 8 glasses per day? That's a good thing, right? We should all be drinking 8 glasses of water every day. I'm not sure if I do it, but we should all be doing that. Is that the primary importance, though, related to hemorrhaging? It's a good thing, it is, but it's not the primary thing related to her surgery. Okay, it doesn't affect hemorrhaging, does it? Okay, it's a good thing to do, but it's not related to hemorrhaging. So we can get rid of number 2. All right, look at number 3. Is it of primary importance to stop taking vitamin E 1 week before the surgery? Okay. So, like we did with number 1, we asked ourselves, does this cause clotting or does this cause thinning of the blood? So, what about vitamin E? Does it cause clotting or does it cause thinning? Yeah. Okay. Good. Good. It causes thinning. All right. So, if vitamin E causes thinning, and we look at that in relation to hemorrhaging, is that of primary importance? Yes, that could be. This number 3 could be our answer, right? That's probably a very good answer, all right? Let's look at number 4 just in case, all right? Number 4, is it of primary importance to have nothing by mouth for 24 hours before surgery? Okay, you guys are telling me no. Why not? Why do we put patients NPO before surgery? Is it because we're worried about hemorrhage? No, it's because we're worried about aspiration, okay? Whether they're NPO or not does not affect whether they will hemorrhage or not. It prevents aspiration, okay? So, and 24 hours, what do you think about that? That's a little too long. Okay, they only need to be NPO for at midnight or 8 to 12 hours prior to their surgery. Okay, so 4 is not a good answer either. It's not related to hemorrhaging. So the only one here that thins out the blood is number 3. Okay, so the number 3 is going to be our teaching that is of primary importance. Okay. Okay. So good job. That one wasn't too hard, but it was a little harder than the first one we did. Okay. All right. But this is, remember, when you take NCLEX, you're going to be thinking a little faster than this because you'll be used to critical thinking. But this is what we're talking about when we say you have to think critically about these questions. We have to ask ourselves which one we think is more important. We have to connect information, okay? Right? If we didn't know this was a priority question, that could have affected our answer, right? if we didn't if we didn't notice that hemorrhage was the topic, well then we might have picked something that was related to clotting, right? So that's why we got to critically think. We got to ask ourselves these questions. Okay, good job. Question number 3. Okay, this one's gonna be a fun one. A client at 38 weeks gestation is brought to the emergency department after a motor vehicle crash. She reports severe, continuous abdominal pain. The nurse notes frequent uterine contractions and mild, dark vaginal bleeding. What action should the nurse take? Select all that apply. Okay. This one's a little bit of a tough one, okay? So I'm gonna give you 3 minutes instead this time, okay? Remember, take a deep breath, slow down, make sure you understand your question, okay? All right. If there's anything that you know is wrong just by looking at it, get rid of it, okay? Start by getting rid of that, okay? And then two, use that sauna strategy, okay? All right, start those 3 minutes now. All right, guys, we're almost at 3 minutes. To put those answer choices in, we're gonna take a look together. All right, question number 3. A client at 38 weeks gestation is brought to the emergency department after a motor vehicle crash. She reports severe continuous abdominal pain. The nurse notes frequent uterine contractions and mild dark vaginal bleeding. What action should the nurse take? Select all that apply. Okay, so what do we know about this question? 38 weeks. Where is she at? If she's at 38 weeks of gestation, where is she at? Yeah, she's full term, okay? She's a full term mother, okay? So we can keep that in mind. What are some things that are abnormal here? What are some things that we should be concerned about? Severe continuous abdominal pain. Yeah, absolutely. All right. That's important. Yep. The dark vaginal bleeding. Okay. What does it usually mean when we see dark bleeding instead of bright red bleeding? Okay, good. Yeah. That typically indicates something with the placenta. Okay. Maybe they're typically placenta abruptio, okay, or abruptio placenta, right? All right. So dark bleeding is typically something with the placenta. What if we see bright red bleeding? What does that kind of indicate? What if this question said, the nurse notes frequent uterine contractions and bright red vaginal bleeding? Okay, good. Placenta previa. Okay. Placenta previa, where it's covering the uterus, okay, or the cervix. Good. Okay. So, is this an emergency or is this expected? Is all of this an emergency or is it expected? This is emergency. Yeah, this is urgent. Right now, none of this is normal, and we are concerned about our mother's life. We're also concerned about our baby's life right now. Okay, this is urgent, right? So what action should the nurse take? Those are our instructions. Select all that apply. What is our select all that apply strategy? Okay. What is our strategy for select all that apply? Good. True or false? Got it. All right. What we're going to do is we're going to do two things as we go through this here. One, we're going to rephrase this as true or false questions. All right. And then number two, we're going to give ourselves a little bit of a rationale for why it's true or why it's false. It doesn't have to be a long rationale. Just we have to give ourselves a rationale. Okay. All right. So let's do this. Number one. Should the nurse anticipate emergent cesarean birth? True or false? Yes, this is true. Why? Because she's full term. This is an emergency, okay? And both her and the baby are in danger. Okay? So yes, this is a true statement. Number two, should the nurse apply continuous external fetal monitoring? True or false? Yes, this is very true, right? Very true. Until that baby is born, we need to know what is going on with it. We need to know if there's been any trauma, okay, or any compromise to the baby. Okay, so yes, we would definitely want to do fetal monitoring. Okay. Number three, should the nurse assess routine vital signs every 4 hours? True or false? Yeah, good. False. Yeah, you guys got that right. False. This is an emergency. She may or may not be stable. Okay. All right. So every 4 hours is not enough. Okay. We need to be monitoring her more closely. Okay. Those vital signs need to be done more frequently. Okay. So three is not a true statement. Let's leave it out. Right. Eliminate it. Next one, four. Should the nurse draw blood for a type and cross match? True or false? Yeah, that's a true statement. Absolutely. She's showing signs of bleeding. Okay. We don't know how bad the bleeding is. Okay. But she may need a blood transfusion. Okay. So this is a true statement. All right. Number five, should the nurse initiate IV access with a 22 gauge catheter? True or false? Good, you guys got that. False. Why is it false? That sounds like a good thing, right? Remember, we're possibly giving a transfusion. Don't we want to start an IV? Yeah, good. You caught that. Okay. It's too small. All right. We need a bigger catheter if we're going to give her blood. All right. An 18 gauge, even a 16 gauge if we can get it would be great, but at least an 18, at least a 20. Okay. So Number 5 is a good example, guys, that if you don't, the answer has to be totally correct or it is totally wrong, okay? So that little part right there where it said 22, it made our whole answer wrong. If that was changed and it said initiate an IV access with an 18 gauge catheter, would it be a true statement? Would we add it in? Yeah, we'd add it in. It'd be a true statement, okay? So, but remember, because of that one part, this whole answer choice is incorrect, okay? So our answers in this one were number 1, number 2, and number 4, okay? Good job. Important, did you see how we used the SATA strategy, okay, to get our answer, okay? That's the important part, all right? We've got to start practicing that SATA strategy. One thing that is good about SATA, guys, is you will receive a partial credit now on NCLEX. You know, previously students, they either got all of the SATA questions right or they got it all wrong. They didn't get partial credit, but you guys are going to be getting partial credit on your NCLEX for SATA questions. So that's a very good thing. Okay. All right, let's get moving to question 4. The nurse is caring for a 10-year-old diagnosed with osteomyelitis. What is the best activity the nurse can suggest to promote age-specific growth and development during hospitalization? Okay. It's a good question, isn't it? All right. So we're going to start that 2-minute timer. Remember, don't rush. Take a deep breath. Okay. Take your time. And I'll see you in 2 minutes, okay? All right, guys, so our 2 minutes is up here. Go ahead and put those answer choices in. Let's take a look together. So question number 4, the nurse is caring for a 10-year-old diagnosed with osteomyelitis. What is the best activity the nurse can suggest to promote age-specific growth and development during hospitalization? So what type of question is this? It's a priority question. Okay, so good. Remember, there's that keyword in there, best, all right? Best activity, all right? It doesn't want to just know an activity. It wants to know the best activity, okay? And what is our topic here? It doesn't say it in the question, okay? That's why it's a tricky one. But the topic here, what is the topic? I want us to know if anyone got it. It's the developmental stages, right? Yeah, our topic is the stages of development, right? Okay. So that's what we're getting tested on here. So we're looking for the appropriate developmental stage for a 10-year-old, okay? So which a 10-year-old, what developmental stage is a 10-year-old in? Yep, that's a school age child, okay? So that's school age child. What developmental stage what does that mean for them? Good. Industry versus inferiority, okay? So their goal is to increase their competence or to be able to over how to say um, their developmental challenge is that they have to learn how to be confident. They have to learn how to become good and to problem solve with those things. Okay. And if they don't do that, then they experience inferiority. All right. So we're going to look for something that helps them with competence. All right. That helps them with that industry. Okay. So number one, fantasy play with puppets. What? First of all, first of all, are there any answers in here, guys, that you know are wrong? Just by looking at it, you know it's wrong. Yeah, you're right. I think number one, we know that number one is not appropriate for is not appropriate for a 10-year-old kid. So let's get rid of one. It's done. Okay. So we're gonna go straight to number two. Okay. So number two, invite friends to come and visit. Okay. That sounds like a really nice thing. Is that going to help them with becoming confident or competent with their work? Not really, right? Friends are a good thing, right? Friends of friends are a great thing, right? But does it help him with his developmental stage? What is his developmental stage, right? It's industry versus inferiority, okay? And industry is all about him building competence and being able to do things well. So, are these friends going to help him to grow in competence? Not specifically, okay? Not specifically. I don't think two is going to be our right answer, okay? Number three, does providing missed schoolwork help this patient with building competence? Yeah, doesn't, right? It gives him the opportunity to be productive, right? And to, you know, grow and to perfect whatever he's studying at school. So, yeah, this could be it. all right? Number 4, does watching favorite movies promote competence in our patient? It could be fun and it could be a good distraction, but it doesn't build competence, does it? It doesn't build competence. So between 2, 3, and 4, the only one that provides competence or helps to build competence or industry is number 3. Okay. So number 3, provide missed schoolwork, is the only right answer. Okay. Okay. Good. So now our last standalone question, and then we're going to move to our case study. Okay. So question number 5. The parent of a 4-year-old tells the nurse that the child won't go to sleep at night due to a fear of tigers living under the bed. Which response by the nurse is most helpful? Okay, good question. All right, so go ahead. We're going to start that 2-minute timer and go. All right, guys, that's our 2-minute timer there. Let's take a look together. Question number 5. The parent of a 4-year-old tells the nurse that the child won't go to sleep at night due to fear of tigers living underneath the bed. Which response by the nurse is most helpful? So this is a tricky one a little bit. It's a tricky one because what type of question is this? We saw keyword there, right? Most helpful. So we know that this is a priority question, okay? What else is it? It's also a therapeutic communication question, all right? So they've gone ahead and they've made it tricky, and this question is both a prioritization question and a therapeutic communication question, all right? We've done a lot, but talk to me real quick, therapeutic. What are some of the that we should do in therapeutic communication? we always want to listen to our patients, right? And want to provide correct information, right? Acknowledge and listen to what they're feeling, and we also want to provide information. Okay, what are some things that we don't want to do in therapeutic communication? Good. Someone said, "Don't ask why." Good. We don't say, "Don't worry." Good. Or don't be judgmental. Excellent. Yeah. Don't ask closed-ended questions. Yes or no questions. We ask open-ended questions. We don't tell them to do anything just because the or just because the nurse said so. All right. We don't talk about ourselves, or we don't tell them what we would do in their situation. Right. We don't know what they would do. Okay. All right. So those are some things that we don't do during therapeutic communication. All right. So if we see any of those things, don't worry, or why statements in here, then we can get rid of it. Okay. See yes or no answers in here, we can get rid of it. So any why questions? I don't see any. Okay, any don't worry questions? I don't see any. Any yes or no questions? Yes, we do. We have one yes or no question. Which one is it? It's number 2. Okay. Have you revisited the zoo? That's yes or no question. Maybe the tigers look scary. So we know that NCLEX doesn't like yes or no questions. So we're going to get rid of number 2. Okay. 2 is already gone. Now that means we only have to choose between now. Okay. So let's take a look at number 1. 1, night fears are common. The nurse says night fears are common at this age. Look under the bed with your child. Okay, so does this acknowledge what the patient's parents are telling her? It does, yes. And is this information accurate? Is it true? Yes, it's true. It is common at this age, right? That is very common. Okay, 1 could be a very good answer. Okay. Number 3, if you agree with your child, the fears could continue through the stage. Okay. So 1, does that acknowledge what the parents are telling? And it's true. Okay. Does it acknowledge what the parents are telling them? Yes, it does. Is it a true statement? Is it unusual for a 3-year-old to think there are tigers underneath his bed? No, that is not unusual. That's very common, right? At 4 years old, they're using their imagination and they're being creative, okay? So it's very normal for them to experience these things, okay? Very, very normal. All right. So between we have 3 and we have 1 left over. Between 1 and 3, which one do you want to go with? I agree. I think 1 is a stronger answer. All right. And we're looking for the most helpful. All right. So number 1 is our strongest answer. There we go. True. Okay. Someone said, look under the bed with your child. Go ahead and what it means is get on the floor, look underneath the bed, check and see if there's any tigers. Let the child see if there's any tigers underneath there. That's what it means. Okay. So good. That was all our standalone questions, guys. So remember, the most of the questions that you you're gonna answer on NCLEX are gonna be standalone questions, okay? Like the ones we just answered. All right. Now we're gonna move to our case study, okay? Case studies are new on the NCLEX, all right? They just added them in April, all right? And they make up about 18 questions on your exam. Okay, there's typically about 3 to a maximum of 5 case studies, okay? But 3 is the most common number, okay? And each case study has 6 questions, okay? The good thing about case studies is that it's just like what you guys do every day in the hospital, okay? So it's very easy for you guys to kind of anticipate and to think through these questions. So you have an advantage as nurses, as professional nurses, that other test takers don't have, okay? So case studies are a good thing, and they help to increase our nurses' scores. So very important. We're gonna skip that. Okay, so let's take a look. SB. Mr. and Mrs. B arrived to the emergency department with their 6-week-old infant. As the triage nurse, you ask the couple why they have brought SB to the emergency department. Mrs. B states, my baby breastfed well for the first couple of weeks, but has recently been throwing up all the time, sometimes a lot and really forcefully. He looks skinny and is hungry and fussy all the time. The couple has been homeless for the past month. SB has no primary care since discharge after delivery. Okay. Admission vital signs. He has a temperature of 98.9 degrees Fahrenheit, a heart rate of 140, a respiratory rate of 35, blood pressure of 104/47, and an SpO2 of 98% on room air. Okay. Labs. Okay. There is a CBC, a CMP, a UA, and a blood pH all ordered, and those results are pending. Okay. There is also an abdominal ultrasound ordered, and those results are pending as well. Okay. Now for there are no medications for this patient. Orders are 1, vital signs Q4 hours, 2, strict in 3, 30 mLs of every 3 hours PO, peripheral IV insertion, NG placed to low and continuous wall suction, and daily weights. Okay. So what do you guys think about these orders? Anything here that is you're concerned about, or does this look appropriate? I'd say these look pretty appropriate, right? For a patient that's throwing up, not able to keep anything down, about right. They have normal vital signs, so I think it's appropriate for them to get Q4 vitals. That's about right. Um, the Pedialyte is a good idea. Okay. I would agree. Someone said, Sandra said, why would you feed Pedialyte and then have an NG tube? So maybe that's something that those two are contraindicated in each other. That's good that you noticed that. All right. Well, our first question here is click to highlight which findings shown in the chart view require follow-up by the nurse. All right. So what things do we want follow-up on? Good. He's recently been throwing up. Okay. That's a good one. All right. A lot. Okay, that's very good. Okay. What else? Yeah, good. Skinny, hungry, fussy. Okay. Skinny, hungry, and fussy. What else? Good. Good, Sheena. Sheena said homeless parents, right? We definitely want to follow up on that. As we know, they're not getting the care they need, but these parents might not be well either. Okay. What else? No primary care since discharge. Yep. Good. Got it. So just like we said earlier, we want to follow up on this order for the 30 mLs of Pedialyte and the order for the NG tube. They cancel each other out. Okay, doesn't make sense. Doesn't make sense to have them both. Okay. All right, good job. So moving to question number 7, there is a new set of vital signs. Okay. So our scenario has been updated. Our temperature is 98.9 degrees Fahrenheit. Heart rate is 155. Respiratory rate is 32. Blood pressure is 101 over 52. And oxygen is 97% on room air. Okay. We got our lab results back, and white blood cells are 7,800. Hemoglobin is 11.1. Hematocrit is 50. Sodium is 128. Potassium is 2.6. Chloride is 90. Our abdominal ultrasound came back, and the results are that they saw narrowing at the opening of the stomach to the duodenum. Okay. All right. So those are our updates to our scenario. Okay. Now, question number 7 asks us to select from the drop-down list below to choose which findings are most concerning. All right. So what type of question is number 7? Good. It's a priority question. Awesome. We've been doing lots of priority today. All right. Number 7 is a priority question. Our key word there is most. Okay. So when we look at this, we might get 4 good answers, but there's one that is the best answer. Okay. That is most appropriate. Okay. So when we review our baby's EMR, our options for most concerning are the white blood cell results, 2, the vital signs, 3, the increase in respiratory rate, or the abdominal ultrasound results? Which ones can we get rid of right away? Get rid of one, okay? Get rid of one because our white blood cells are 7,800. 7,800, that's normal, okay? That's normal. We don't need to be concerned about that. Get rid of that one. Number 2, we might we can get rid of number 3, increase in respiratory rate. Why? Because the respiratory rate actually has gone down, right? So remember, when they came into the emergency department, the respiratory rate was 35, and now our updated vital signs, the respiratory rate is 32. Okay, so we can get rid of that. That leaves us with vital signs and abdominal ultrasound results. For vital signs, our O2 is good. Our blood pressure is pretty normal for a month-old baby. Respiratory rate is actually normal. Heart rate is actually normal, okay? And there's nothing wrong with the temperature, okay? So vital signs are pretty stable. Is there anything that we need to, we're concerned about with the abdominal ultrasound? Yes, right? It says there's narrowing at the opening of the stomach. What does that sound like, narrowing? Maybe there's some kind of stricture or stenosis or maybe some kind of blockage, right? Okay. So we're going to get rid of the vital signs because they're normal. And our correct answer is the abdominal ultrasound results. These are the most concerning findings. Okay. All right. So good. Good. So you guys are starting to notice the information and you're starting to put all the pieces together. A lot of you are saying this is possibly pyloric stenosis. Okay. All right, good. Okay. That's very possible. So we'll keep that in mind as we go to our other questions. All right. Possibly pyloric stenosis. What else could it be? Is there anything else that it could be? What do you think? Anything else that could be? It could be number 8. word characteristics of it. Yeah, okay. So it's a true statement. So can this be one of our answers? No, it can't, okay? Because a negative query, we're looking for an incorrect answer. Okay, so we have to get rid of number 3, all right? Number 4, the new nurse says, I will place the client on telemetry. Is that something that should be done for this patient? True or false? Yeah, true. That's something good, right? That is something you would do, okay? This one is a true statement, so we're going to get rid of it, okay? We're only looking for incorrect statements. Okay? And then last, number 5, the new nurse says, I will record strict intake and output of the client. Is that true or false? That's true, right? That is something that you should do for a patient with sclerotic stenosis. So remember, we're looking for untrue statements, so we can get rid of this. The only statements here that are untrue or false statements are number 1 and number 2, okay? All right? Okay. Because this was a negative query, the correct answer was an untrue statement, and the only untrue statements are number 1 and number 2. 3, 4, and 5 are all true statements, okay? So that's why. That one got a little tricky, okay? Remember, if you didn't read through the question and we didn't catch that it was a negative query, it would have been really easy to make a mistake there, okay? Next question. So question number 9. Ooh. SB returns to your unit after a successful pylotomy. Which of the following interventions can be delegated to nursing assistive personnel? Okay, so we're talking about our UAP or our LPN, right? When can we delegate? We can delegate when our patient is stable, okay? We cannot delegate unstable patients. All right, we're not allowed to. All right. We don't know if our patient is stable yet, okay? But it doesn't say that our patient is unstable, okay? Okay. So we're going to do the same thing as we did with all our other selected all that applies, okay? And we're going to rephrase it as a true or false question, okay? So number 1, can teaching the parents the rationale for the surgery be delegated? Who can do teaching? Only the registered nurse can do teaching, okay? LPN and UAP, they can reinforce teaching, but only the registered nurse can do teaching, okay? So number 1 cannot be delegated, all right? Not true. Okay. Number 2, can reminding the parents to save diapers to be weighed be delegated? Yeah, so remember the initial teaching has to be done by the RN, but can a UAP or an LPN remind the parents to do something? Yeah, sure, absolutely. Once that initial teaching is done, they're allowed to remind and reinforce. So number 2 is a true statement. Okay. Number 2 is a true statement. It can be delegated. Okay. Number 3, can obtaining vital signs every 4 hours and reporting any abnormal findings to the RN be delegated? Yes, it can be, right? Absolutely. Our LPN and our UAP can do routine vitals for us, okay? And if there are abnormal vital signs, they should always report it to the nurse. So, 3 can be delegated, and it's a true statement, okay? How about number 4? Can assisting the parents to care for the surgical incision be delegated? No, it cannot, right? Remember, the nurse has to be the one who does everything first, okay? Right? And surgical incision, would you leave that up to the UAP or do you think a nurse should do that? A nurse, right? Because a nurse needs to teach them how to assess for signs of infection, right? Right? Only the RN can do that. Only the RN can teach, okay? So number 4 cannot be delegated, right? Cannot be delegated. So we have to get rid of it, right? How about number 5? Can reporting to the RN with concerns that the parents have about administering Pedialyte be delegated? Yes, that can, absolutely. So yes, that should be delegated to the that should be reported to the nurse. So our correct answer here, guys, was number 2, number 3, and number 5. Okay, these were the only interventions that could be delegated. Okay, LPNs are allowed to do dressing here, but number 4 doesn't say it doesn't say complete dressing on surgical incision. It's it says assisting the parents to care for the surgical incision. Okay, so that's teaching right there. Who can do teaching? Only a registered nurse can do the teaching. Okay, all right. So that is why number 4 is only the RN. Okay. After the nurse teaches, the LPN can change the dressings. They can, and they can reinforce teaching. But number 4 didn't say just change the dressing. It said assisting the parents to care for the surgical incision. Okay. And that involves teaching. All right. So good question. All right, so guys, that was everything today. Good job. I know we had lots and lots of priority questions, so I hope you guys got good practice with that. We did a little bit of SATA today, so I hope that that helped you guys as well. Remember, guys, number one thing about doing these questions is number one, take a deep breath. And take your time, okay? Remember, you get 5 hours to take NCLEX, okay? Most people do not use 5 hours, okay? So you're not gonna run out of time on the NCLEX. Take a deep breath, Take your time with the question. Make sure you understand your question, okay? And then number two, learn those testing strategies, okay? Learn those testing strategies. They're there to help you, okay? Remember, NCLEX doesn't want to test what you know. They want to test how you use the information, okay? So that means you gotta have those testing strategies. You have to have that critical thinking, okay? So go to that Learn Upon account, all right? Do those recorded webinars and start using those testing strategies, okay? Rosa, you're welcome. Immaculate, Dennis, Susanna, my pleasure. If you guys would like to join me, I also do sessions on Thursday afternoons from 2:30 to 4. So you're always welcome to come to that as well. Mika, Natasha, Sheena, you're very welcome. Maria, Pius, and Anthony, absolutely, my pleasure. Charles, Agnes, very welcome. Thank you. Happy Thanksgiving to you guys as well. So, absolutely. Jared, my pleasure. Good to see you. All right. I will see you next time, guys. Take care of yourselves.